Just about 9:30, cancer is the second leading cause of death in the U.S., only after heart disease.
February is National Cancer Prevention Month, and it's an important time to learn about prevention and what screenings to ask your doctor about.
Joining us this morning is Dr. Cynthia Cantu, a primary care physician at UT Health San Antonio. Good morning, Dr. Cantu.
Good morning.
So we have read and heard articles for years about ways to help prevent cancer. And I think it's always good to have kind of a refresher conversation because you guys are always getting new data, always new research being done. What are some of the current ways we can tell people to lower our risks of cancer overall?
Well, it's actually just going back to the basics, the things that we primary care physicians tend to talk to our patients and nag about. They say it's, eating a healthy, balanced diet that includes fruits, vegetables, whole grains, avoiding tobacco use, limiting your alcohol intake, exercising, maintaining a healthy weight because obesity has been linked to increased cancer risk. And of course, making sure you're staying up to date with your physical, with your primary care doctor, because that way you can discuss further what cancer screenings you need based on your age, your gender, and your family history.
And why are these cancer screenings so important, and why should we start with our primary care doctor there?
Screenings are very important because it's a way to be proactive and to be able to detect any abnormalities before the patient has symptoms. And that way, if there is any present, we can treat early and decrease mortality.
What are the types of screenings that help with early detection?
So thankfully, we do have various tests available. We have mammograms. This is for breast cancer screening for females. We also have cervical cancer screening available, and this is done with HPV testing and cytology. There's also colon cancer screening with colonoscopies, and or if you prefer, you can do stool-based testing. And there's even now lung cancer screening done with low-dose CAT scans.
And you're just talking about some of those screenings. What about the age? When should we start getting these screenings?
So there's a variety of expert groups that provide these recommendations. So the age to start may differ, but for the most part, the American Cancer Society recommends to start cervical cancer screening for average risk women at age 25. And this is done with HPV testing alone. If it is done with that, it has to be a specific FDA-approved HPV testing. If not, you can do HPV with cytology, and this is every 5 years, or cytology alone. And it's recommended to discontinue at age 65, provided that your previous cancer screenings have been normal and you've been staying up to date. Mammograms for breast cancer screenings should start at age 40, but it's very important to discuss this further with your primary care doctor because there is some harms if you start that early. If not, you can start at age 45 as recommended by the American Cancer Society. And then for men and women, it is recommended to do colon cancer screening at age 45. The frequency will vary depending on the results. And there's also prostate cancer screening, and this is with a blood test. But it's also very important to discuss further with your primary care doctor because there's also some risk associated with that. And you can start at age 55 for the American Urological Association and the U.S. Preventive Services Task Force.
All right, Dr. Cantu, thank you. For more information, folks, you can call 210-450-1000 or visit cancer.uthscsa.edu.
Thank you, Dr. Cantu.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.